Happy day to all. Welcome to Physiotherapy Competitive Exam Series. Contact details for license exam crash course are given in the description. The child's left leg is shorter than the right in supine position with the hips and knees flexed. Assessment findings indicate that the child has developmental dysplasia of the hip. Before the surgery, traction is ordered to the patient. Which of the following is the most appropriate traction for the patient? A. Buck's extension traction, B. Bryan's traction, C. Russell's traction, D. 90-90 traction. The correct answer is B. Bryan's traction. It is the most appropriate traction for a patient with developmental dysplasia of hip. This traction helps keep the top of the femur in the hip socket. Buck's extension traction is more appropriate for hip fractures. Russell traction is indicated for patients with femur fracture. 90-90 traction is indicated to children with a fracture in the femoral shaft. A patient may recover after a stroke by natural neurologic recovery. This form of recovery allows improved motor control. Which of the following is a common pattern of motor recovery following a stroke? A. Upper extremity is more involved than the lower extremity at onset. B. Motor recovery in the upper extremity is greater than in the lower extremity. C. The prognosis for useful return of hand function is favorable even when upper extremity paralysis is complete at onset. D. The severity of upper extremity weakness at onset. D. The severity of upper extremity weakness at onset is an insignificant predictor of eventual motor recovery. The correct answer is A. The upper extremity is usually more involved than the lower extremity at onset. In spite of this, motor recovery in the upper extremity is less than lower extremity motor recovery during rehabilitation. Based on this finding, the severity of weakness in the upper extremity at onset is a significant predictor of eventual motor recovery. The prognosis for return of useful hand function is unfavorable when the upper extremity paralysis is complete. A female piano player is referred to the clinic for treatment of carpal tunnel syndrome. The physical therapist reviews the patient record to create a treatment program that is most appropriate for the patient. The therapist expects to find which of the following assessment findings on the record. A. Pain with resisted wrist flexion. B. Pain with resisted wrist extension. C. Pain during valgus stress with the elbow and 25 degrees of flexion. D. Pain in ventral aspect of the wrist that radiates to the ventral forearm. The correct answer is D. Carpal tunnel syndrome is characterized by pain in the ventral aspect of the wrist that radiates to the ventral forearm. Option A is a finding in medial epicondylitis. Option B is characterized by lateral epicondylitis. And C indicates injury to the ulnar collateral ligament. Being able to distinguish neurogenic from vascular claudication is essential because each condition requires specific treatments. The absence of which of the following should suggest the diagnosis of neuroclaudication? 1. Paralysis. 2. Paresthesia. 3. Pain. 4. Pulselessness. 5. Pallor. A. 1, 4 and 5. B. 2 and 3. C. 1, 2, 4 and 5. D. 1, 2, 3, 4 and 5. The correct answer is A. The absence of paralysis, pulselessness, and pallor suggests the diagnosis of neurogenic claudication. The 5 P's of vascular claudication include paralysis, paresthesia, pain, pulselessness, and pallor. I hope this video would have been useful to you all. For more such videos, stay tuned to our channel. Thank you.